spinal misalignment, often caused by poor posture, repetitive stress, or injury, is like throwing a wrench into the gears of your body's machine. When vertebrae are out of place, the once smooth chain becomes kinked, disrupting the flow of movement and creating undue stress on surrounding structures. Imagine a garden hose with a kink in the middle. The water flow is disrupted and pressure builds up around the kink. Similarly, a misaligned spine disrupts the smooth transmission of force from your core, causing stress to accumulate in the muscles, ligaments, and discs. This uneven distribution of force leads to a cascade of problems. Muscles surrounding the misaligned area become tight and overworked, trying to compensate for the instability. Ligaments, the tough tissues that connect bones, can become stretched or torn. Intervertebral discs, the cushions between vertebrae, may bulge or herniate under pressure. Restoring optimal movement and alleviating pain requires a comprehensive approach that addresses the root cause of the problem, spinal misalignment, and its downstream consequences. This involves a three-pronged approach: restoring mobility, enhancing stability, and building strength. Think of it as a three-legged stool. Each leg, mobility, stability, and strength, is equally important for optimal function. Neglecting one leg will make the stool unstable and prone to collapse. By addressing each of these components, we can restore the spine's proper alignment, retrain the body to move efficiently, and empower you to live a life free from pain and limitations. Section 6. Stability. Strengthening the links. A chain is only as strong as its weakest link. Similarly, a stable spine requires strong supportive muscles acting like dynamic guy wires, holding the vertebrae in their optimal position. Stability training focuses on strengthening the deep stabilizing muscles of the core, those responsible for maintaining spinal alignment during movement. These muscles act like a natural corset, providing internal support and preventing excessive motion that can lead to pain and injury. Exercises such as planks, bird dogs, and side planks target these deep stabilizers, teaching them to fire in a coordinated manner to protect the spine during everyday activities. By strengthening these links in the chain, we create a stable base for movement and prevent further misalignment. Section 8. A holistic approach: acupuncture, art, and FMS. Treating the core-spine connection effectively requires a holistic approach that addresses not just the symptoms, but the underlying causes of dysfunction. This means looking at the body as an interconnected system, where each part influences the whole. This is where the combined power of acupuncture, active release technique, ART, and functional movement systems, FMS, comes into play. Each of these methods offers unique benefits that, when used together, can provide comprehensive care. Acupuncture, an ancient healing practice, involves inserting thin needles into specific points on the body to stimulate energy flow and promote healing. This technique has been used for thousands of years and is known for its ability to balance the body's energy. It can be particularly effective in reducing pain, releasing muscle tension, and improving mobility. Many patients report significant relief after just a few sessions. ART is a hands-on soft tissue technique that identifies and breaks down adhesions in muscles, tendons, and fascia, those tough, fibrous tissues that can restrict movement and cause pain. This method is highly effective for treating chronic pain and improving range of motion. By restoring proper tissue texture and movement, ART helps restore biomechanical efficiency. This means your body can move more freely and with less pain, enhancing overall function. FMS is a system of assessing movement patterns to identify imbalances, limitations, and asymmetries. This assessment is crucial for developing a personalized treatment plan. By pinpointing these dysfunctional patterns, we can tailor exercises and therapies to address your specific needs and restore optimal movement. This approach ensures that each patient receives the most effective treatment for their unique condition, leading to better outcomes and improved quality of life. Section 10. Conclusion: move better, live better. Unlocking the power of the core-spine connection is not just about alleviating pain. It's about enhancing your overall quality of life. It's about restoring your body's innate ability to move freely, perform optimally, and live life to the fullest every single day. By understanding the intricate relationship between your core, spine, and limbs, and by embracing a holistic approach to treatment and wellness, You can reclaim your movement, enhance your well-being, and unlock a world of possibilities. Remember, movement is medicine. By prioritizing your spinal health and embracing a proactive approach to care, you can move better, feel better, and live better for years to come, enjoying every moment. Michael Woodworth at Makari Wellness in San Diego is one of the few specialists in the country who has mastered a unique approach to comprehensive care. With over 20 years of experience, Michael has dedicated himself to mastering non-surgical modalities that address the complex interplay between mobility, stability, and strength. His approach is not only comprehensive but also highly specialized, often delivering results where others have failed. If you're struggling with chronic pain, movement issues, or are looking to avoid surgery, contact Makari Wellness today and discover how Michael's unique blend of techniques can help you achieve lasting relief and better health.